The following module will cover universal precautions as part of the medical student simulation-based surgical skill curriculum. The video you're about to watch was created by Dr. Salcedo and Dr. Ferris from UC Davis, based on the module content authored by Dr. Woodman from SUNY Downstate in Brooklyn, New York. After completing the module, you should understand the principles of universal precautions, including the differences when compared to sterile technique. Most importantly, the module aims to teach you the appropriate techniques on how to approach patient contact, handle body fluids encountered in the course of care, and guidelines to follow in the event of an exposure to fluids from patients with transmissible diseases. So what are universal precautions? They are a set of standards created on how to handle the blood and bodily fluids for patients with transmissible diseases in order to protect healthcare professionals from risk of infection. Interestingly, the history of universal precautions, more recently referred to as standard precautions, dates back only to the 1980s in the setting of the HIV epidemic, prompting focused attention on techniques to prevent cross-contamination between patients to other patients, and also to healthcare personnel. The issues surrounding privacy and patient confidentiality came into play, requiring that all patients, regardless of infection status, be treated similarly to avoid stigmatizing any one population over others. Even though it may seem like these practices should have been in place for generations, based on our collective understanding of bacteriology, parasitology, and virology, they are a relatively recent development in the long history of medical care that continues to be perfected even today. At-risk body fluids include any fluid that is visibly contaminated with blood, and all fluids in situations where it is difficult or impossible to differentiate between body fluids. Examples of these kinds of fluids include feces, urine, semen, vaginal secretions, cerebrospinal fluid, synovial fluid, pleural fluid, pericardial fluid, peritoneal fluid, and amniotic fluid. Examples of fluid that are not considered to be of similar risk include saliva, sputum, sweat, nasal secretions, and vomit. The majority of this video module will describe and demonstrate the proper procedures healthcare professionals need to observe when working with patients with potentially transmissible infections. The necessary supply list is shown here. Each of these items should be readily available in any patient care area you find yourself working. If something is not available, be sure to alert the staff members who manage the location to assure adequate stock. Here's an example of the materials mentioned. The colors and fit for some of the supplies may vary from location to location based on brand names. Functionally, there are a few differences between the products. Biohazard waste bins are colored red and are lined with the red bag with the biohazard symbol on it. The red waste bins should be used exclusively for materials containing at-risk body fluids, described earlier. Note that these red bins come in all shapes and sizes. The next several videos will demonstrate the appropriate technique for hand washing, handling bodily fluids, and also varying levels of isolation precautions that you will encounter in the course of seeing patients, particularly in the hospital setting. Start hand washing with wetting your hands under running water. Next, apply soap and rub your palms together to ensure complete coverage of both hands. Spread and lather the soap over the back of the hands. Make sure the soap gets in between the fingers of both hands. Grip the fingers of each hand and pay close attention to washing the thumbs. Press and rub your fingertips into the palm of each hand before thoroughly rinsing your hands. Dry them off with a clean paper towel after the rinsing. If your hands are not soiled, you can use an alcohol-based gel instead of washing your hands with soap and water. The technique is shown in this video. Be sure to spread the alcohol-based gel on the surfaces of both your hands across all of your fingers, paying particular attention to your thumbs. Spread the gel until all of it dries. Some locations will have a foam rather than a gel. Wall-mounted units like the one shown here may contain either the foam or the gel. The technique for the foam is similar to the one for the alcohol-based gel. Foam is not easily poured from one hand to the other. A pump of foam into each palm helps get adequate coverage of the fingertips and for both hands. When handling low-risk bodily fluids, you must wear gloves at all times. Non-sterile gloves are appropriate. After removing gloves, be sure to wash your hands with soap and water if visibly soiled, or an alcohol-based gel or foam if appropriate. Even if you did not make contact with any fluids, remember to wash your hands. High-risk bodily fluids should also be handled using gloves at all times. Non-sterile gloves are also appropriate. These materials must be disposed of into a hazardous waste container as described earlier. High-risk body fluids should never be placed in the routine waste receptacle. Note that patient care areas often have these waste containers located right next to each other. Some patients will be placed on isolation because of certain infectious pathogens. Depending on the pathogen and the precaution, different measures are required and subject to hospital policy. Contact precautions for infections such as Clostridium difficile, or C. diff, require the use of gloves, gowns, and hand washing prior to entering and exiting the patient's room. In the example of C. diff, hand washing with soap and water is necessary prior to exiting the room, because the gel and foam are not as effective at stopping the spread of C. diff. Droplet precautions for infections including pneumonia or influenza require the use of a surgical mask upon entering the room. Airborne precautions for pathogens that are exceptionally small, like tuberculosis, require the use of a specialized mask designed to block smaller molecules. These masks require specialized fit testing so that you know what size is effective for you. Sometimes, no matter how carefully you are working, you will sustain an injury while handling bodily fluids. Familiarize yourself with the protocols in place at your institution for needle sticks and similar workplace injuries with the risk of exposure. If you have an exposure event, immediately wash your hands and cleanse the wounds. Most hospitals have a hotline that you can call so that you can open a case and get evaluated in short order. Be aware that depending on the clinical status of the patient from which the fluids involved came from, you may be started on medicine to treat or prevent an infection. As with any technique, it is important to avoid common errors. Some are associated with being new to an experience, while others are associated with the experience being so common that shortcuts are attempted, usually not consciously or intentionally. Remember that universal precautions are not the same as sterile technique. Sterile technique uses special gloves and gowns and requires a mask and head coverage when performing operations and some bedside procedures. You do not need to use sterile technique when handling bodily fluids and for the majority of patient contacts. Even if you are touching areas of the materials that appear to be clean, it is not appropriate to handle them with your bare hands. As mentioned earlier in the module, be aware that the red biohazard waste receptacles in patient care areas are often located right next to the routine waste container. It is not appropriate to place materials with high-risk bodily fluids into the routine waste cans to avoid risking exposure to personnel who handle the waste, though not directly involved in patient care. Finally, do not become complacent when it comes to thorough hand washing before and after patient contact and handling material with bodily fluid. In summary, remember that precautions are in place to protect you and your patients from transmissible infections. As a general practice, it's a good idea to use gloves and wash your hands if you catch yourself wondering if you ought to do either of those things. Familiarize yourself with the protocols in place for exposure events for each site or hospital where you are rotating and working. Locations in the same system may have slight differences in protocols or different phone numbers to call, so it's important to know those details. Always remember that it is your responsibility to observe the precautions demonstrated in this module to protect yourself and your patients, and also your duty to help remind team members and those around you who are also taking care of patients to practice responsibly. Here are some resources for you to review in addition to the written module accompanying this video.